Hi, everyone. I'm Beth Sanders. I'm the co-founder and CEO of LifeBio. And when my grandmother was living with dementia, I started recording her memories, and I'll never forget it. She lit up. And suddenly I saw her as a whole person. And that moment changed me and it inspired LifeBio. So at LifeBio, we're humanizing dementia care through personal stories and reminiscence therapy, proven ways to improve connection and well-being. Our platform's evidence-based. Our research partner discovered a significant change from baseline with frequency of depressive symptoms lowered for people living with dementia. Too often, people's voices get lost in care, and we believe their stories and preferences should drive care decisions. And that's why we built LifeBio Memory, a HIPAA-compliant AI-powered app that prompts storytelling and securely captures voices, memories, and care preferences. In 2025, we received a $2.9 million NIH SBIR Phase 2B grant to scale LifeBio Memory, adding further reminiscence therapy components and multi-language support. For 2026, we've secured $500,000 in new contracts across 4 states, including a 100-site organization. We also work with Mayo Clinic as an intervention for newly diagnosed people living with MCI. We'll capture at least 3,000 LifeBios in the coming year. So we have worked with nursing homes, home care, hospice, and health systems. So it's a wide market where we're serving older adults primarily. So people 65 and older for sure is where we're focusing in B2B healthcare settings. And so it's been amazing to actually be across multiple, it's just organically happened over time that we've served these different parts of the healthcare system. Senior living has been a major focus for us because in that sub-market of memory care, they're very interested. But for example, we just started a partnership with Senior Helpers. So I'm trying to move us toward that, getting involved earlier and often with people that are in home care before they're in the senior living market. And I also think if someone has this diagnosis, what are we waiting for? Let's get their story now so they can say their own voice what they want for their care and who they are, giving a summary of who they are to the care providers, whether they're in home or in these community-based settings, is helpful. But senior living's been the focus today, and we need to expand that big time. And since 2013, we've been part of the amazing StartUpHealth community. We've received invaluable coaching on fundraising, product market fit, and entrepreneurship. And I had the honor of recording Stan Krein, the father of the founders of StartUpHealth. And even after his passing, Stan's story now lives on. So looking ahead to 2026, we're seeking introductions to health systems using the new guide model for dementia support, and we're raising $1 million to expand our B2B commercialization strategy. Together, we can restore dignity, connection, and humanity in dementia care, one story at a time. Thank you.
Beth, thank you, and forever grateful for you capturing my dad's story. Forever priceless, and thank you. Meryl framed it as giving people dignity, and I know you provided that to our family during a very important time that is only once it's gone, and I appreciate it forever, and it's really made a big difference. So thank you.